And welcome into the medical program here today, brought to you by the specialty clinics at the Bryan Hospital. And today I'm lucky enough to have an old friend with us, Dr. Ken Redcross, who is the author of Bond, the 4 Cornerstones of Lasting and Caring Relationship with Your Doctor. Ken, how you doing today?
I am doing well. Thank you, Jim, for having me on. Hello, everyone out there.
It's always good to have you on. You know, we hooked up a number of years ago, and then that pandemic thing kind of came through, and everybody's schedules went sideways, didn't they?
Oh, it totally did. But luckily, guys, we are back to normal life. I know they're saying there may be a little bit coming, but we're more prepared for it now. So it's good to get back to normal life again.
Well, before we get into the topic of the day, because you are seeing a little bit here and a little bit there of darn stuff coming back, what is your thoughts? What's going to happen to us now? Another one of our lockdowns, or are we better off nowadays?
No. We are much better off, Jim. So, yeah, everyone, is a little bit of a rise, but the good thing is we're all prepared. We have a lot of immunity now, whether you are a vaccine person or not. You've been exposed, so you have some natural antibodies circulating. So I think it's kind of become kind of like the flu, where the flu is just something that we deal with each and every year, and I think that's kind of where we are as far as COVID going forward, even though we still have to be careful of those who are immunocompromised or elderly, but we should just be smart.
Yeah, amen. I think that's the wise decision, even back before we knew what it was. You know, be smart.
Yep, I agree with you.
Hey, today I've got you on the telephone because we're going to talk a little bit about TikTok and some of the things that people might see medically related on TikTok. And I think, like an awful lot of folks, when they see it on TikTok, they believe it's the truth.
Right. They believe it's law. You know, and it's funny. I always joke around because, it used to be about Dr. Google and that sort of thing. Now it's TikTok, Doc. And to your point, everyone's seeing these things on TikTok, and they're taking them kind of as law. And different than other docs, Jim, I don't want to necessarily come down on TikTok, Doc, but I do want everyone to kind of make sure that they understand exactly what the challenge is about, and more importantly, make sure to rope your doctor in there so that it's specific for you, not just some TikTok person out there talking.
Now, one of the things that's on, and I think folks have probably seen, is what they're calling nature's Ozempic. Can you fill us in a little bit on that?
Yeah, so that's the big one, everyone. So look, for all of my people out there who are diabetics or maybe have family members, so Ozempic is a diabetic medication, which obviously helps for blood sugar, but a big reason why you've been hearing about it is that you get a lot of weight loss with it, which is a desired effect for a lot of people. But in that kind of excitement, what's happened, Jim, is that a natural ingredient called berberine has been roped in because berberine does help for blood sugar support as well. But this is when I had to come out and kind of say, pump the brakes, because berberine is helpful for blood sugar support, but not for weight loss, weight management. There's some studies out there, but they're too early, Jim, to kind of talk about it. But I kind of had to come out and kind of dispel some of what's going on there so that we can really focus on the big benefits or the good benefits of berberine and that it didn't get mixed up in the Ozempic craze.
Let's talk Ozempic first before we get into berberine, because every time you sit down at night, you see an Ozempic ad after Ozempic ad after Ozempic ad.
Really do.
And they always come with that little disclaimer at the end about all the bad things that might happen to you if you do take Ozempic. What's your thoughts on Ozempic, first of all?
All right, so I'll tell you this, everyone. So, Jim, you may recall, so I am a Western-trained physician, everyone. I trained at Columbia many moons ago, but I've learned about the alternatives or kind of the natural ways of healing. Now, Ozempic is on that Western side of healing that I learned in my training, and Ozempic is great because it can help with fasting blood sugar, so when you're just relaxing or after you're eating the blood sugars. But one of the benefits as well is that it works on a hormone that all of us have circulating that helps with our hunger and appetite. So that's how Ozempic really does the kind of the magic, I guess you can look at for weight loss. But you may have seen in the news lately, Jim, as well, what you're getting is because Ozempic decreases kind of the emptying of the stomach, everyone, which keeps our blood sugar, we're having people who are having what's called gastroparesis, which is kind of reading as paralysis of the gut. So now you have people who are saying, oh, my God, I lost all this weight, but I feel like there's this big kind of weight in my stomach. I'm having nausea. I'm having vomiting. And so that's kind of why it's important that when these crazes come out, to make sure that you speak to your doctor about them so that you can fully understand if you're a good candidate for that particular medication.
Wow. Yeah, and you know what? That is the one thing that so many people, I think, have now. We've circumvented the doctor way too often. Okay, we see it on TV. Oh, it's got to work, even though it does say check with your physician.
Right.
It is a situation where we leave the doc out of the equation too many times, don't we?
Yeah, we do, and we shouldn't do that. And the reason why I say this is that I'm not here to, once again, beat up Ozempic on the Western side of healing, but I am here to clarify, everyone, the real way berberine should be used. So berberine, as I mentioned, it's a natural ingredient. It's located in the golden seal, the root of the golden seal, the root of the barberry plant. And the benefit is that it's for blood sugar support, and number two, also cholesterol support. Not so much on that weight management piece. But now that you see, Jim, that it's kind of blown up, you see all these different berberines. So patients are always like, oh, my gosh, I went on Amazon, I went to get berberine, there's a million of them. How do you kind of pick and choose which ones you should go for? And so that, once again, is a discussion that you definitely should have with your doctor. It's one of those things that is so important to me that, especially as patients are more open to alternative ways of healing and support, that they understand the supplement and what they're going to put into their bodies.
So what are some of the things that berberine can do, and what are some of the fears you might have as far as the side effects to somebody that uses it?
Well, look, so let me tell you, so those out there listening, who should look at berberine? Those who have type 2 diabetes for sure should know berberine well. Also, those who have insulin resistance. So, in other words, if you're elderly, or if you have, or if you're overweight or obese, as we say, and so depending on how big you are, those are the ones that berberine was actually created for, and you get the best benefit. The other thing is figuring out, because there's a million of them, which one do you choose? So I prefer one by a brand called Doctor's Preferred in particular, Jim. The reason why it's doctor formulated and doctor vetted, and above all, everyone, when you're looking for supplements, you want to look at seals that have the GMP, which is Good Manufacturing Practices. That's a third-party group that comes on the outside, Jim, and makes sure that berberine is actually in the bottle. I have so many patients that have gotten fake berberine or berberine that isn't good, and I do know with Doctors Preferred, the docs are involved in this, and it's important. It makes me feel good as I talk to them, because I act as an advisor for them as well, because patients are kind of lost out there. And so when you're looking for these things, just make sure that they are vetted and that you truly understand. Now, the good thing with berberine is that because it is a natural ingredient, I mean, look, I feel good in that there's not so much in the way of side effects profiles. I can't say that with Ozempic, of course, because we've talked about that at the top of the segment. But with berberine, I don't get many calls back with any issues or any challenges. So it's nice to be able to talk to patients about something that can support their blood sugar and doesn't really keep me up at night with potential side effects.
Wow. Now, for many of the folks that are listening right now, they may already have a group of medicines that they take each and every day. Should they be concerned maybe with the reaction that they might have when they start with berberine?
Oh, that's a great question there, Jim. So look, everyone, as we talk about berberine or any of these supplements, there's a couple of things I want you to make sure of. You want to make sure that you ask your doctor, Doc, I'm thinking about taking this berberine. Are there any drug interactions I should worry about? The reason why I say that, Jim, is let's say you are a diabetic and you're on something else to help lower your blood sugar. I want to make sure you talk to your doctor so your doctor can say, okay, let's try this, let's decrease that, or what have you. The other thing I want you to think about, are there any contraindications? In other words, are you pregnant? Are you breastfeeding? Do you have liver disease or kidney disease? That's another reason to go to talk to your doctor before starting any supplement, even though we're talking about berberine. And last but not least, I always talk about, if you're looking at these supplements, Jim, bring them to the doctor's office. I love going line by line whenever patients bring in the supplements so that I can explain each one and we can have a discussion around it. It's like, once again, bringing the doctor back into the fold as well. So it's not to kind of beat down everything that you get that are some of these hacks, Jim. It's to better understand them and how do they fit you and your situation.
Now, should somebody, when they look at this, they listen to the conversation we're having today, now it is not an Ozempic, it is not a medication that oftentimes a conventional, traditional doctor would prescribe. Should they be a little bit fearful to bring that in and ask their doctor about it, or generally do doctors look at something like this and say, okay, let's take it easy, let's talk about this, let's have the conversation that Dr. Redcross and I would have?
Yeah, and that's the important part, Jim. You know, I'm always into the patient-doctor bond. That's my whole brand and my passion. And so that's the point. You should be able to go into your doctor's office and say, hey, look, I just heard this doctor on the radio and talked about berberine. Doc, what do you think? And when you go to your doctor, so you don't get blown off, and we're busy, and I understand the doctors we don't always mean to, or some doctors don't. The point is that you want to come with information and you want to come with questions and a plan. I call it really a strategy. So when you go in there, you want to ask the doctor, bring pen and paper, because you want to take notes. You also want to ask them, you know, doctor, is there anything I should be concerned about? Is there anything you're concerned about? In other words, you want to make this an active discussion back and forth so that you feel like you both are partners in your healthcare journey. You know, we're the docs, and we're there because we're educated to keep you healthy and whole, but this still is a sharing back and forth that we need to be able to have. So you shouldn't be nervous to kind of go up to your doc. Hopefully, you know, your doctor will embrace it, and he or she will tell you their thoughts on whether they think this is a good thing for you and why, or not, and also why.
Yeah, you know what, I tell you, I think we have lost that over the last couple generations here. Doctors used to make house calls, and they used to be your best friend and all those kind of things. And now I do feel like at times we hide way too much from our docs.
I know, you're right. You know, it's funny, Jim. I have my little black bag in my truck. I still make house calls. So I'm a little bit of a throwback there. But, yeah, you know, so much has changed in healthcare. And, you know, because we're all so busy, meaning the doctors, it's hard to get in and see your doctor. It's hard to get your questions answered. That's when things like berberine being called nature's Ozempic happens, right? You can't get into your doctor. You heard about this berberine, but you don't know how it works. You've heard about Ozempic, blah, blah, blah. And so it becomes challenging when this, you know, with everything that's changing. And so that's why it's important to come here. Believe me, there's going to be million more TikTok hacks that come and challenges, but this is a positive one. I was excited because now so many more people know about berberine. They know about Doctors Preferred as far as a brand that's been vetted, and also to just look online for those who have that seal, Jim, that all-important GMP, good manufacturing practices. It's important for any supplement, everyone.
Dr. Ken Redcross is my guest right now. We need to step away and play a couple commercials, pay a couple bills. When we come back, there are a couple of other things I want to talk to you about that they see on TikTok, and get your impressions of maybe where we're going with TikTok and whether we should spend more or less time with certain different challenges that are up on TikTok nowadays. You've got the Q and the medical program here on the Q 96.5 FM. Back again with Dr. Ken Redcross. And, Doc, we talked a little bit about berberine to open everything up, but, you know, more and more people are just absolutely fixated on TikTok, and they've got to do what the folks on TikTok are doing. And there's a number of challenges out there, and oftentimes they're health challenges. Give me some thoughts about whether they should be very quick to adhere to some of these things they see on TikTok.
Yeah, so look, I want you to be very, very careful because some of them seem pretty simple, Jim, but they can be very, very involved. One in particular is the water chugging challenge. Now, as a doctor, I love anything you talk about that's going to be talking about patients taking in more water, right? We're all 60% water. It's extremely important. You always remember that old adage of, 8 ounces 8 times a day of water, but the point is that's not the same thing for each and every patient. In other words, Jim, I have patients who have heart failure or other diseases where we don't want them to take that much liquid in. So if you're looking at these hacks and you just go out and start chugging this water, you can have some really big issues and some consequences that you don't want to have happen. Not to mention that our body doesn't like a large amount of water at one time. That can cause hyponatremia, which is a long word that just means it brings our sodium levels down, everyone. And your body does not like our sodium levels brought down drastically and quickly as well. There's another challenge that's an interesting one, and I like this one. Once again, on the surface, everyone, from the outside, it's great, but we have to dig deeper. And this is called the Hot Girl Walk Challenge. Now, this is a young lady. I think she was around 21 or 22, but she was quarantining and had the fabulous idea of saying, I'm going to get out, I'm going to exercise a bit, I'm going to walk, and I'm going to think of 3 important things about how grateful I am And more importantly, she was going to give herself some self-love and remind herself how hot she was as well. So I know it's pretty interesting, right? But I love the self-love component there, Jim. Totally love that. But once again, guys, you can't just pop off the floor and just get out and start walking. I love the positivity, but you have to talk to your doc. I have older patients. Some I need to make sure, do you have the right footwear? I don't want you to twist your ankle. We need to talk about prepping before exercising, stretching, things of that nature. So here you are. You look at two things that seem pretty easy, right? You're just like walking. You're just taking in some water. But once again, without that relationship and that kind of understanding with your doctor to be able to say, Doc, what do you think about these challenges here? Are they good for me? So, yes, they're good, but not everyone exactly the same way that the TikTok doc kind of framed it.
Yeah, and again, one size doesn't fit all, does it?
There you go, Jim. Very well said. Exactly. You're preaching to the converted there because you're absolutely right. One size does not fit all, but just because it's on TikTok, everyone, doesn't mean that, that it's law, as we said.
Now, another one that you had up on your site was box breathing. What is box breathing?
Now, this is a fun one here, everyone, because I'm a big meditator, and I'm always talking about the spiritual side of healing. Not necessarily religious, everyone, but the spiritual side. In other words, what makes you happy, what makes you full. And so this box breathing challenge is all about mindfulness. You take in this really deep breath, and then you hold it and exhale and hold it again. And you do this rhythmically. Now, the reason why I love this is because I have so many people and patients who are dealing with just, anxiety and the S word, which is stress. I never like to say stress, but the S word. As we all deal with this, box breathing is so valuable. So I love this particular challenge. My only caveat here is that if you find yourself really needing this box breathing often, or you're realizing that you're kind of not getting the benefits that the box breathing can offer, I need you to make sure that, once again, you pick up the phone and talk to your doctor. I don't want you to have an underlying anxiety disorder. I don't want you to have a panic disorder, or even depression can present this way sometimes. So once again, this is a good challenge as far as what it looks like on the surface, but sometimes we have to peel back the layers to make sure that it fits you. So if you feel like something like that is happening, you pick up the phone, you call your doc.
Hey, you know what? I'd be remiss if I let you go without asking just your general impression of social media on our health at all, with TikTok or Facebook or anything else that goes on nowadays.
Well, you know me, John. I'm a positive guy, so I'm going to see everything as positive. So, look, I think social media is trying. I think it gets us into the gateway, right? I think it starts the process, and then it's up to us to be able to get a little bit deeper and make sure that it fits us with the help of our doctor as well. Then I'm good with social media if we do it that way.
Hey, I've always wished that you would move from New York and come to a rural town in Ohio. You know what I mean? But I don't think that's going to happen anytime soon, right?
No, well, not yet, but I do love Ohio. I will visit, I promise.
So before I let you go, how would anybody that heard our conversation today and would like a little more information about Dr. Kenneth Redcross, how would they go about looking you up?
Oh, well, thanks for having me on again, Jim. It's great being with you guys today, and I really, really mean it. Reach out. Say hello. My website is drkenredcross.com, and if you want to learn more about berberine and other doctor-vetted supplements, doctorspreferred.com is a good location, but please reach out and say hello. I'd love to talk to all of you.
Now, one last topic that I want to talk about, because we're doing this right around lunchtime, and I went out and grabbed an Arby's here today, okay, and gobbled it down, and you told me you had not had an Arby's in probably 20 years. So what does Dr. Redcross's diet look like?
Oh, gosh, funny. It's funny, everyone. But that's all right, Jim. It got better because you held off on a little bit of the bread. You held off on a little bit of the sauce. So I was teasing with Jim, everyone, because I ascribe to this 60-20-40. I like to make sure that each one of my meals has 60 grams of carbs, 40 grams of protein, and 20 grams of fat. And the reason why I say that, it reminds me about balance. And believe it or not, it's like a mindful way to eat as well. But once again, it's just about the importance of nutrition, movement, and spirituality. And so bringing all those together, I believe, gives us the beautiful life experience that all of us deserve.
Well, there you go. I knew I was going to talk to you, so I threw the half a bun away, and I got lucky because they had no Arby's sauce today. So
awesome!
I just fell into that one, Doc. How's that? I just fell into that one. How's
perfectly.
Oh shucks! It's always fun to talk to you, man. Let's not make it so long in between conversations.
I agree with you as well. And thank you again for having me on, everyone. And I mean it. Really reach out and say hello. I love meeting new people.
Dr. Ken Redcross, our guest today. With that, we're heading back into Classic Hits here on the Q, 96.5 FM.